All right, thank you all so much for joining for today's webinar on the legal landscape of telehealth audio only and asynchronous care. Um, I am Lydia, CTeL's policy analyst, and I am joined by Sophie, who is our membership and operations director. Just a couple housekeeping things before we get started in the content. We will provide the recording and materials after uh, today's webinar as well. And I also wanted to share in the chat for you a little one-pager summarizing the main themes of today's content. If you have any questions during the presentation, feel free to put them in the chat. I'll keep an eye on that. And we will also have time for questions and discussion after the main presentation as well. And with that, I'll turn things over to Sophie.
Hi, everyone. Thank you so much for being here. My name is Sophie Fisher. Um, a lot of you may have met Lydia before, but this is maybe your first time meeting me. I'm pretty new at CTeL. I started as our membership and operations director at the beginning of December. I am also a JD and a licensed attorney, so I've been doing some legal research here at CTeL as well. Right now, what I'm working on is updating these 50 state survey reports that CTeL publishes. So our report on the legal landscape of telehealth audio only and asynchronous care was last updated in, I think, 2019. So a great deal has changed since then. And so the research we're about to publish is just going to go over some of the major changes and give an overview of the landscape. Uh, from a 10,000 foot view, the major landscape is that things are kind of different in every state. 50 states, 50 ways to get it wrong. There is tons of diversity. Some states explicitly include audio only care. Some states explicitly exclude audio only care. Some states have more shaky rules or more specific rules. And so we are going to kind of go over what exactly the landscape looks like. So So, for a little bit of background, audio only care typically means care with no video component, but it is synchronous. So, for instance, it might be a telephone, it might be a Zoom call with no video, and then asynchronous or store and forward technology. Providers review information sent by the patient, and that could be things like text messages through a patient portal. It could be things like sending in pictures, for example. Maybe you have a sore throat. You send in a photo of the back of your throat for the doctor to review on their own time. And the practitioner-patient relationship is established when a clinician serves a patient's medical needs. Generally, the relationship is entered into by mutual consent, but sometimes there are greater requirements to form that relationship. For example, in some states, there needs to be a physical exam before the relationship can actually be established. In some states, it's enough for both the patient and the provider to simply agree that there is a relationship. So, at a glance, as you can see, there's a lot of variety here. 14 states explicitly including audio-only care, 10 states explicitly excluding audio-only care. Some states permit audio care, but not on a first exam. Half of them do permit audio only for the first exam. Um, some states allow you to use a questionnaire to establish a relationship. Other states explicitly say you can't use a questionnaire. In many states, the issue is simply not addressed. Uh, and then there are some questionnaires which are static, so just filling out checkboxes, answering questions. And some states have, or some providers have questionnaires that adapt as you answer the question. For example, you answer one question, the patient answers one question, and then it branches off into other questions based on the previous answer. And some states distinguish between those two types of questionnaires, and they might allow an adaptive questionnaire, but not a static questionnaire. Um, More and more states are starting to look at AI in a healthcare context, but overall, AI in healthcare is still a little bit of a Wild West. A lot of states haven't even established a definition of what AI means in state law. And so that is a developing field that has a lot of room to grow. So as you can see, Uh, there are a number of different states allowing different modalities. In some states, all three modalities qualify. Some states, video and asynchronous only. Some states, video only. Um, so the most, uh, some states are going to permit telehealth for initial exams. Some states are going to require the exam to be conducted via real-time synchronous communication. Um, just to talk about some states more specifically, some of the most restrictive states are going to be Virginia, where audio only is explicitly excluded. There must be interactive audio and video, no questionnaires at all. Maryland, no audio only, must be synchronous audio visual, no questionnaires. Iowa, audio only excluded. You can have static questionnaires, but there must be a medical interview and a physical examination. Tennessee excludes audio only from telehealth definition, requires real-time interactive video. And then here in DC, where we're located, it's especially restrictive. Audio is entirely excluded. There must be real-time audio-visual for telemedicine and synchronous audio-visual patient evaluation before treatment can begin. Lydia? So medical questionnaires are kind of gaining more acceptance as the technology gets more complicated. That is an emerging trend. Um, More and more states are starting to allow it. Um, so states are increasingly distinguishing between static questionnaires, those that allow follow-up questions. And I think that as AI becomes more accepted in a healthcare context, we will probably start to see these questionnaires more and more. Right now, there are 9 states that explicitly make the distinction. Um, so I saw we have a question in the chat. I think we're going to get through the overview and then we'll probably come back to questions in a little bit. Uh, so right now, um, there are only 2 states that are prohibiting the use of AI to establish a relationship. In most states, it simply hasn't been addressed yet. This was the first year that a lot of states, or I should say last year, 2025, was the first year that a lot of states really began to start thinking about it and putting regulations on the books or trying to. There are a number of states where bills are being discussed or in process or are expected to come up in the next session, but very few have actually gotten those laws on the books yet. So right now, there are 14 states that have a statutory definition of AI. Um, 11 states that reference AI specifically in a healthcare context, but no states that are explicitly permitting AI to conduct physical exams for establishing a patient-physician relationship. Um, 3 states prohibit AI for this purpose: Delaware, Ohio, and for the purpose of mental health, Nevada. Um, Next slide. So the broad takeaway is that most states have started to enact more comprehensive laws since 2020. But with things like AI, there's also more complexity. Audio only is becoming more accepted. A lot of states, which once explicitly prohibited it, like Florida, have since amended their laws to include it. It's becoming more accepted, especially in situations where video is less available. For example, areas without great access to broadband, uh, or Some states are allowing it in a conditional context where a patient doesn't have access to video. There's increasingly more distinction between static questionnaires, which are not permitted anywhere, and adaptive questionnaires that are gaining more acceptance. All states require that telehealth services meet the same standard of care as in-person services. Uh, and there are differences in some states between what is legally allowed versus what Medicare will actually reimburse, even if it is a permitted treatment. And I think with that, we can probably move on to questions.
Great. So I see Dana's question in the chat. In all states that require a physical examination, does the law make it clear that such a physical exam can be done via telehealth?
Great question. The answer is no. Some states don't address it. Some states do address it, but say that a physical exam can't be done via telehealth. Some states are explicit that a physical exam can be done via telehealth. Um, so, for example, Montana includes audio-only care in their telehealth definition, and a relationship can explicitly be established via telehealth. New York, same. Wyoming, same. So Alabama permits uh, the patient-physician relationship to be formed uh, without an in-person meeting. Florida as well. So Alabama, Florida, Montana, New York, Wyoming are going to be some of the more restrictive states. Iowa, for example, does not allow telehealth for the physical examination. There must be a physical examination done in person before there can be telehealth treatment. Does anyone else have any questions or comments? Lydia, is there anything you wanted to add?
Sure, yeah. I think one of the main reasons that CTeL produces these 50 state surveys for our members is that whenever you're expanding your business model into multiple states or into new states, I think this presentation and some of this research that Sophie did makes very clear that the requirements for different examination requirements, audio only and asynchronous requirements differ from state to state. And so it's important to have a solid understanding of each state's laws and requirements to make sure that you are in regulatory compliance for not only in terms of meeting the standard of care for your patients, but also in terms of managing your organization's legal risk as well. And so this is the first of a series of updated legal research reports we'll be putting out, especially given the recent changes in telehealth law since 2020. There has been a lot of confusion over whether or not new requirements are in place. And so we'll continue to be putting out these research reports for our members to help address some of these questions and ensure that your business remains compliant in all 50 states. I see another question in the chat. The obvious broader question, does any state address whether application of these requirements mention whether it is provider or patient state? Oh, I think you're muted.
Generally speaking, the the rule is based on where the patient is located. So if a patient is in a given state, the laws of that given state apply, even if the doctor is treating them from out of state. Lydia, correct me if I'm wrong, but I believe that is universally the rule.
Yep. Especially when it comes to cross state um, provision of care. The rules and licensure follows the location of the patient. This is because the medical boards in each state have an interest in regulating the care of the patients in those states. And so if you're providing care to a patient, say that's located in Ohio, you have to follow Ohio's rules because that state's government made those rules in the interests of the patients in their state. And so the general rule of thumb, especially when you're looking at state laws, is to follow where the patient is located.
So some so some states that have more unique regulatory approaches, for instance, California, when Medi-Cal is paying, new patients must use synchronous audio video care, but audio only is permitted for sensitive services. So, for example, audio only is permitted for things like substance abuse treatment, reproductive care, uh, gender affirming care, things like that. Georgia permits audio only modalities only if other modalities are unavailable. In Hawaii, you can do audio only behavioral health, but that requires a non-audio visit within 6 months. And that you can't, it excludes standard telephone calls from telehealth. So, for instance, a lot of states will allow audio only treatment, but not through a normal telephone line, through a more secure internet platform. For example, something like a proprietary uh, platform that isn't that is secure and compliant. Uh, Texas is one of the first states to start enacting AI healthcare laws that require practitioner oversight, review, and disclosure when AI is being used. More states will probably make that explicit and put it on the books as well. For instance, right now, most states don't have a law that says if you're using AI to treat a patient, a doctor has to go back and look over what the AI did and provide oversight. And those laws aren't on the books just because it hasn't been an issue, but I think most states will have that law on the books pretty soon. In Utah, if there is an AI interaction, there are disclosure requirements, and that specifically covers medical and mental health advice. And that law went on the books in May of last year. So the landscape is evolving pretty rapidly, especially in a post-pandemic world when telehealth has become much more of the norm and everyone is trying to catch up with all the new technology.
Any other questions on some of the topics we covered today? If not, our contact information is up on the screen. You're welcome to reach out to us at any time.
Thank you so much, everyone.
And I'll put in the chat one more time the copy of our one pager for this webinar. We'll also follow up with the recording and any follow-up questions that you may have as well. With that, that's all that we have for today. Thank you so much for joining for today's webinar. I hope you have a great rest of your day.
Thanks so much, everybody. See you soon.